Welcome to the first of 6 podcasts in the series Helping Patients and Caregivers Take the Next Step in Care, Medication Management. In this podcast, an introduction to medication risks during transitions, CMS NSIC-V 2011A, Susie Butler and Carol Levine will explain the medication risks faced by patients who transition from one care setting to another. This podcast is produced as a partnership between CMS and the United Hospital Fund's Next Step in Care campaign.
There's so much that the doctor tells them during their discharge and during their admission time there that they leave with a big question mark above their head, and then they show up to the pharmacy and they don't know what the doctor told them.
They have to know what they came in with, what they're leaving with, and to reconcile those on paper with reasons. So the families and the patients know. And it's important to talk to families too, because sometimes the patients themselves are overwhelmed by the experience and don't absorb it all.
So when you take your pills, do you take them in the morning or the evening?
Morning.
Morning?
Mm-hmm.
Do they give you any in the evening too?
Mm-hmm.
Just morning?
Yeah, I take one at night.
If you are a healthcare provider or one of the 44 million Americans who are unpaid family caregivers, what you just heard must sound pretty familiar.
And you're probably not surprised to learn that doing a better job of getting the right dose of the right medicine at the right time would go a long way toward meeting one of the Partnership for Patients' goals, to help patients heal without complications.
Today, Carol and I are here to help providers and caregivers think about the steps involved in medication management, especially during transitions to and from hospital, long-term care, and home care settings.
I direct the Families and Healthcare Project at the United Hospital Fund in New York. We've created the Next Step in Care campaign, working with healthcare professionals and family caregivers to change healthcare practice by recognizing, training, and supporting family caregivers, especially at times of transitions in care. One thing we've learned is that the key to medication management is communication. First, everyone who's treating the patient has to share information about what is being ordered, what is being discontinued, and why. The transition to electronic health records will help with that.
The real challenge is communicating with patients. When the patient is a minor or an adult with cognitive or psychological problems, that means communicating with one or more caregivers. The National Network for Health Innovation and the National Quality Forum found that one group most likely to be readmitted is patients taking 6 or more medicines who have depression and or poor cognitive function and a history of prior hospitalization.
In 2010, in a study published in the Archives of Internal Medicine, hospitalists at Yale compared what they thought patients knew with what the patients thought they were told. Doctors thought patients knew a lot more than they actually did. Only 18% of patients knew the doctor's name. Only 57% of patients knew their diagnosis. And while 2/3 of patients left the hospital with a new medication, 90% did not know about possible adverse reactions. Involving caregivers in discharge planning increases the likelihood that vital information about medication actually goes home with the patient. Poor communication can lead to adverse reactions or noncompliance, resulting in readmissions or poor outcomes. Supplementing oral instructions with notes, written instructions, and business cards, and scheduling follow-up calls and appointments can help even more.
We know there's a lot more to innovation and improvement than just passing out checklists and putting up posters. That's why we want to share the experiences of doctors, pharmacists, and family caregivers like me, people who deal with these issues in the real world.
We know that time is always in short supply for clinicians and caregivers, so we've structured this program so that you can watch it all straight through, or you can watch a module at a time to fit the program into your busy schedule. The program is also appropriate for caregiver training, either as a loaner, as part of a structured program for caregivers in a hospital, or just to play in a waiting room.
Do you know the importance of medication management for chronically or seriously ill patients? The role of family caregivers in medication management? How to use this video in different settings. Thank you for listening to this CMS podcast. You may also be interested in the other podcasts in the Next Step in Care series: medication reconciliation, medication management, monitoring compliance, help with medication costs, and caregivers and medication management. The information you heard was correct as of the date it was recorded, July 28, 2011. This podcast isn't a legal document. Official Medicare program legal guidance is contained in the relevant statutes, regulations, and rulings. Thanks for listening.